My name is Alyiah Navarro, and I'm going to be performing a postpartum assessment on my patient. And so I'm going to begin. Okay, so my patient's name is Yellow Pillows. Her date of birth is May 23rd, 1990, and she doesn't have any allergies. Hi, Miss Pillows. I'm going to be your student nurse today, and I just checked your name and date of birth and your allergies. So today we're going to be performing a postpartum assessment on you. It's going to be fairly quickly. It's going to be fairly quick. So I'll just begin. So the first thing that we're going to start with on this assessment is just assessing her breast real quick. Making sure I'm going to be palpating her breasts and asking her if she has any pain or if she's noticed anything weird about her breasts, and then I'm just palpating and make sure there's no abnormal swelling, redness, abnormal discharge, skin discoloration, things in that nature. And Miss Pillows has normal breasts for postpartum. So next I would ask her if she has a bra, and she says she does, and make sure it's supportive and a good bra that will keep her comfortable. And so she has a good bra, I made sure of that. And then I would move on to the abdominal assessment. So she would be laying down at this point, and first I would ask her if she has any pain, just so I know not to go where the pain is right away. And first thing I would do is inspect and make sure she has no abnormalities that look out of the ordinary after a birth. Obviously she's going to have a C-section, so she has a C-section / vaginal birth, so I would inspect her C-section line and make for Rita and make sure there's no redness, edema, ecchymosis, discharge, and the approximation of the suture line. Everything looks normal in Miss Pillows. So then after I assess the C-section line, I would go ahead and auscultate for bowel sounds and ask her when her last bowel movement was. She said her last bowel movement was about 2 hours ago. So that's good that she had a bowel movement. And then I would also ask her if she voided before I palpate. Just before I palpate her bladder, because if she does have a distended bladder and she has urine, it might cause some discomfort. And now I'm going to palpate and make sure I don't feel anything out of the ordinary. I'm going to palpate the fundus. The most important part of the abdominal assessment is the fundus. So I'm going to palpate the fundus and make sure the fundus is firm. And midline near the umbilical region. If any of these are out of the ordinary, then if the fundus is displaced laterally, it might be because she has a distended bladder. So then I would feel the bladder and make sure there's no distension or anything like that. So everything feels normal. Her abdomen is firm and her location is midline. And yeah, so then I would ask her when her last void was, and she said, well, it was also about the same time as the bowel movement. So I would ask her to go void again, and I would assess her urine for color, odor, clarity, and amount. Everything looks perfect for a postpartum patient. Her color is normal. Everything's normal about her urine. Everything's normal about her abdomen, her C-section line. So then I will be done with the abdominal assessment. I'll move on to the perineum assessment. So I would start, since she's on her back, I would start by assessing the perineum area for any edema or signs of a hematoma. Everything looks normal on Miss Pillows, so that's good. And then I would assess her lochia. It's very important, so I would inspect her pad and I would make sure that the amount of lochia is either small or scant. Miss Pillows has a scant amount of lochia and she has no signs of clots in her lochia. And a clot would be counted as a quarter size. She has no clots. So that's good. And make sure the color is normal for the lochia, so it should be red. And then also, before flipping her, oh yes, so at this point I would flip her laterally to get a better view of her episiotomy suture. So Miss Pillows, I'm going to ask you to roll laterally to your side. I'm going to help you. And then going to look at her episiotomy and assess for Rita. Make sure there's no redness, edema, ecchymosis, discharge, and approximation. And so everything looks normal. Everything looks like it's healing well. And I'm also at this point going to check for any signs of hemorrhoids, which she has no signs of hemorrhoids. So, I think that's it for the perineal assessment. Okay, so then I would have her lay back on her back, and I would assess her lower extremities. First thing I would do is palpate her popliteal pulses and her dorsalis pedis pulses. Make sure they're equal bilaterally. While I'm down there, I can also assess for edema. She might have slight edema, which it looks like Miss Pillows does have slight edema because of the pregnancy and the fluid retention. So, it's not an abnormal amount of edema, but if it was, I would be concerned. But she has normal pulses and she has normal edema for pregnancy. And then I would assess her Homan sign. So I would dorsiflex her foot, and then I would ask her if she has any pain, and I would look for the color of her calf, and that's it. And then I would assess her, while I'm dorsiflexing her foot, I could also assess for clonus. So if she has an irritable CNS, or if her CNS is irritable, then I might see her foot kind of vibrate, and that's a bad sign. So I would pay close attention to that. But she doesn't have any signs of clonus and no signs of a positive Homan sign. Okay, next I would assess, after the extremities, I'm all done with the extremities, so I would go ahead and assess how she's feeling. Is she feeling sad? Is she feeling down? But Miss Pillows is in a very upbeat mood, and she feels excited to take her baby home, and she's happy she has a healthy baby and to introduce the family to her new baby. Then I would assess how she's bonding with the baby. So I could kind of do that from afar. I don't really have to like make a big deal about this. I could just see if her and her baby are getting along well, if she looks happy to have her baby, if she can breastfeed, if she's having trouble latching, if she's holding her baby a lot. You can just tell just by inspecting how the baby and the mother are bonding. Next, I would inspect if she can assume the role of being a mother. So if she's feeling excited to be a mom and she's doing all the little actions that moms do whenever they're excited to become a mother, or if she's concerned about taking her baby home and her life is chaotic and she's expressing to you that she's going to have trouble becoming a mother, then that would express some concern. But Miss Pillows is excited to be a mom and they're bonding well, so that's a good sign. Lastly, I would assess the infant's needs and then the mother's needs. So I would ask her what she knows first, just to see what kind of education she has. And Miss Pillows came in very educated on taking the baby home and things that she needs to do as a mother. So I would ask her, or I would tell her that she needs to place the baby on its back when sleeping and in a onesie just to avoid any complications and putting the baby at risk for SIDS. I would also ask her if she knows how to clean the umbilical cord region just with soap and water, no alcohol, because it'll dry out the area and it could cause complications with how the umbilical heals. And then I would assess if she knows how to bulb syringe her baby. So you would start in the mouth and then go to suction the nose. And then I would also assess if she has the proper car seat for her infant. So it should be a rear facing car seat that she has to take her infant home, which she does. So Miss Pillows knows all of these things. And lastly, most importantly for the infant, I would ask her if she knows the warning signs of maybe an illness or an infection or something. So first thing I would educate her on is a spike temp 100.4. Anything above is concerning, so she needs to notify her primary care provider. I would also tell her to watch out for profuse vomiting, and more than 2 green watery stools is also a concern. And then lastly, if she doesn't know how to check the temperature, I would teach her how to check the temperature of her infant. So to check the infant's temperature, she puts it in the axillary region, and she makes sure the baby is wrapped or skin to skin, because the baby is still figuring out how to thermoregulate the body, so having it wrapped or skin to skin will help the baby's temperature be accurate. And lastly, I would assess the mother's needs. So first I would ask her if she knows how to give herself self-care. So how to assess the breasts for what's normal with the breasts and breastfeeding and things like that, which she knows everything she needs to know. And then I would ask her if she knows how to assess her perineum area. She could just get a mirror and look down there, or if she feels comfortable, she can get someone to help her assess her perineum. And then I would ask her if she knows how to care for her sutures. She says she does. Just being very gentle when she cleans them and goes to the restroom. And then I would ask her if she knows when and how to take her pain medication. It varies for each patient depending on the medication that they want to take, but it's basically PRN, so she can take it whenever she needs it, and the amount she should take when she takes it to make sure she doesn't overdose on some medication. Lastly, actually 2 more things. I would assess if she's going to use any type of birth control. Miss Pillow says that she is not going to use any birth control, and if she conceives again, she conceives again, which I'm not going to question her on, but if she wanted some type of birth control, I would try to place her in the right direction to get her on birth control if she wanted to. And then, lastly, I would educate her on her warning signs, not the infant's warning signs, and I would make sure she knows that if she has pain in the breast, pain in the perineum, or an elevated temperature, she needs to contact her provider, because there could be some signs of infection or something wrong in the body. So she needs to make sure she pays close attention to her body and her baby's body, and she'll be a set mom, and she'll know how to take care of her baby and herself. And that concludes my head to toe assessment. I mean, not my head to toe assessment, my postpartum assessment.